We now prepare to do a right pneumonectomy. We begin by reflecting the right lung laterally, and doing so we can identify the hilus of the lung. We identify the upper border and the lower border, and when we incise the hilus, we need to take care not to damage the phrenic nerve, which we identify here, running anterior to the hilus. It runs between the mediastinal pleura and the fibrous pericardium, and we must take care not to damage it because it's the motor supply to the right hemidiaphragm. This is a higher magnification view of the region of the hilus of the right lung. For orientation here, we again show the right lung here, and the mediastinum has been pulled to the left, and we have dissected free and isolated the phrenic nerve, which we now identify. We can see in the field here the superior vena cava running from superior to inferior to drain into the right atrium. If we examine the region of the hilus, we can see the right mainstem bronchus. We'll see more of it shortly after we have divided the pulmonary artery, which was immediately anterior and inferior. And then continuing inferiorly, we see the pulmonary veins. We see a superior pulmonary vein and an inferior pulmonary vein. We're now going to divide the structures of the hilus. We begin by dividing the inferior pulmonary vein, which we divide now, and the superior pulmonary vein, which we divide now, and the branches of the pulmonary artery. Which we divide now. As we reflect and clean these structures, we'll soon have a clearer view of the right mainstem bronchus. We now show the pulmonary arteries, which we have divided here, and once reflected, we can identify the right mainstem bronchus and its several of its branches, one there, and one there, and we now divide the right mainstem bronchus proximal to its branch point. In order to complete our removal of the lung, we need to divide the connective tissue structures associated with the posterior layer of the hilus. We now place our finger behind the hilus of the lung, and we divide the connective tissue. And in doing so, we're now able to remove the lung. We've done some further dissection superior to the hilus of the lung in order to identify the vagus nerve. We see here the vagus nerve located adjacent and just lateral to the trachea, which we indicate, and the esophagus, which is difficult to see posterior. As it goes inferiorly, we can identify some small branches here, cardiac and pulmonary branches. Then the nerve passes medial to the azygos vein and courses posterior to the hilus to travel with the posterior aspect of the esophagus. We also re-identify the phrenic nerve, which is anterior to the hilus of the lung. We now have a left lateral view of the chest cavity. For orientation, superiorly we show the manubrium and the midline, and laterally the clavicle. Inferiorly we can see the left dome of the diaphragm, and medially we can see the heart covered by parietal pleura and pericardium and pericardial fat. We identify now the superior border of the hilus of the lung and the inferior border of the hilus of the lung, and we note the close relationship of the arch of the aorta to the hilus of the lung. And we now identify on the left the phrenic nerve covered by parietal pleura. We now continue our dissection of the region of the hilus of the left lung. We now reflect the mediastinal pleura to expose the fibrous layer of pericardium, and posteriorly we reflect the mediastinal pleura to show that it's continuous with the visceral pleura of the left lung. If we go back to the hilus of the lung now, we can identify the left pulmonary artery, and inferiorly the superior pulmonary vein and the inferior pulmonary vein. If we now reflect the pulmonary vein inferiorly, we can see the left main stem bronchus, which is posterior to and below the pulmonary artery. We now show again the arch of the aorta, and we can show the vagus nerve, which is lateral to the arch of the aorta. Now, connecting the left pulmonary artery and the arch of the aorta, we can identify the ligamentum arteriosum. We show here its anterior border and its posterior border. This is a remnant of the ductus arteriosus, which is a structure in fetal development which connects the left pulmonary artery to the arch of the aorta in order to bypass the lungs. If we now look at the nerves, if we can look anteriorly, we re-identify the phrenic nerve. We can see a cervical cardiac sympathetic branch, and hooking around the ligamentum arteriosum, we can identify the recurrent laryngeal nerve, which hooks around the ligamentum arteriosum and runs posterior to the arch of the aorta to ascend to the larynx. We also now identify small vagal branches to the pulmonary and cardiac plexus. We now divide the structures of the hilus in order to remove the lung. We first divide the pulmonary artery, which we divide now. We then divide the superior pulmonary vein and now the inferior pulmonary vein, which we divide. We are now able to identify the left main stem bronchus, which we divide. Which we now divide, and if we free up, we now free up connective tissue structures, which will allow us to remove the lung. We now remove the lung, which has allowed us now to view the posterior thoracic wall on the left.